welcome to Become 4, and I am going to talk about my laser eye surgery with Optical Express as part of Team 21 for their 21st anniversary of laser eye surgery. I had my surgery 12 days ago, and the actual morning of the procedure, I don't think I actually slept very well, to be honest. I was very nervous. I think I went to bed and lay there and all I could see were eyes peering down at me as I was trying to get to sleep. And then at about 3 o'clock in the morning I decided the headache from thinking about things too much had just got too much, so I got up, took a couple of ibuprofen, had some honey sandwiches and went back to sleep and thankfully I actually managed to get some sleep because the appointment was at 9:45 in Cambridge. So Keith drove me to Cambridge and they did all the normal standard tests that they'd done in the consultation, all the measurements, mapping the eyes, the pressure tests, went through all the forms just to make sure you were happy with everything that they'd told you and knew exactly what was going to happen. So I think after all the basic tests it was actually 11 o'clock that I actually went in for the surgery. And it was quite nice. The waiting room upstairs, there were about 3 or 4 other people sitting waiting, and then you could see other people coming out. It was actually quite quickly, you know, in the space of waiting you could see one person go in, about 10-15 minutes later they were coming out into the recovery room. So you realised that it was going to be over with quite quickly as soon as you were in there. Yes, so then obviously 11 o'clock it comes to my turn and we go into the theatre, I don't know what you'd call it, and you lie on a bed with a really nice comfy pillow for your head to sort of stop it moving around, and then they give you the anaesthetic eye drops, which was where I freaked out a bit. I'm not very good with eyes, I don't like people touching my eyes, so the first drops of the anaesthetic eye drop, I think I blinked and it went everywhere. It's like with the pressure test when they did the consultation, I'd jump a mile and hit the ceiling and put my shoulder out. It was the same with the anaesthetic, I blinked it everywhere. And then they went to the other eye, that wasn't too bad. And then they did both eyes again just to make sure that they'd got enough of the anaesthetic in. And then obviously the surgeon's there sitting behind you, telling you what he's going to do, and then they sort of slide you under the first laser, and to actually prepare the eye. Once you've got the anaesthetic in, that stops obviously the feelings, and then they have to put, it's like a little tube that goes over the eye, and apparently it's suction, so it vacuums into place over the eye, so it opens your eyelids can't blink around it. That was the bit that actually I found the worst. You can feel it's people actually fiddling with my eyes again, and putting something in my eye, and then you can feel the pressure of the tube, but then sort of calm down, breathe a few seconds, it's in, all hands are away from me, and I'm able to relax again, and then you're under the laser, and this is the laser that does the cutting of the flap. It cuts the circle of the flap, and that one you don't see very much of. As soon as the laser starts, you're looking straight up into the light that you're told to look at, and then it goes all very cloudy, and then you can hear the laser, and I think that one lasted about 10 seconds, and you can hear it actually working. I couldn't feel anything at all, and there is a slight sort of, it's not a chemically smell, and it's not a burning flesh smell, it's more of a, it's the smell of the laser. Obviously it gives off a smell as it's pulsing, but the actual lasering, cutting the flap, I didn't feel a thing. And then obviously they take the tube off the eye, cover that eye over, and then do the same thing on the second eye, and again freaking out with the tube, calming down again, deep breaths, and then the laser, perfect, not a thing, couldn't feel anything at all. And then obviously they sort of swing you over in your bed over to the next laser, and that's the one that actually shapes the cornea. It takes a little bit longer, but again the surgeon's telling you everything that's happening as they're doing it. Freaking out with the tube again. It's, oh, that was my worst bit. The whole lasers, no problem with. It's people touching my eye, so yeah, the laser, because nobody's actually in my field of vision doing anything, I just wasn't worried about. This laser, this one, you look up into a red light, and this is the one that shapes it, and it's really quite strange because you're sort of looking up, and as you can hear it working, and you can obviously smell the lasery smell, and you can see, I can remember seeing it sort of like a black dot that sort of got bigger and bigger and bigger the longer the laser went on. So I'm just assuming that was it, as it was lasering out, as the circle got bigger as it was lasering it out. I'm assuming that's how I'm imagining it. And you can actually see your vision getting clearer at the same time. It's really weird. Oh, I forgot to mention, obviously before that they have to lift the flap up before they do this lasering, which once they've got the tube in place, that wasn't too bad. It's obviously the tube, my problem. But then the tube's in place and the surgeon just sort of leans over, and I don't know how they do it, but I'm aware of a presence, a dark shadow above me, sort of couldn't feel anything, but obviously somebody did something to pull the flap over, and then obviously the laser treatment, and then the laser stops and you can see and then all of a sudden the surgeon sort of looms over and flips the flap back down again, and it goes a bit blurry again, and then switch to the second eye. And I think it was about this time that I'd had enough of the tube and people messing with my eyes, because I was feeling quite panicky, and I told them that I was feeling a little bit nauseous at that time, and it wasn't the lasers. I mean, there was no pain or anything, it's just people messing with my eye. So I just told them that I was feeling a bit nauseous, so they sort of gave me a few seconds just to collect myself again, and then they put the tube in and did the whole lasering and flipped back the whole flap, and that was it. Take off all the eye, the eye patch on the other eye, the tube on that eye, and that was it. No pain at all. I was supposed to sit up straight away, but I think I sort of got myself into a little bit of a state. I was sort of the nurses pointed out, oh, you're covered in sweat. Yes, that's normal for me. So I had worked myself up a bit, but I'd managed to sort of calm myself down enough to be able to then sit up after a few minutes. And the nurse had very kindly actually gone back out into the recovery room, the dark room that you go to sit in, and she'd put the aircon on for me, which was brilliant. And then basically 10 minutes in the operating room under the laser, well, not even 10 minutes under the laser. Most of it is actually, you know, preparing the eyes for the laser. And then you go into the recovery room and you sit there just relaxing, trying to get your eyes sort of as comfortable as possible, although mine didn't feel that uncomfortable, to be honest. And then one of the nurses comes and goes through the aftercare with you, and you get 3 different eye drops. You get the antibiotics that you have to put in 4 times a day, the anti-inflammatories that you put in 4 times a day, and then the lubricating tear drops that you put in as often as you want. And then you're also given a very, very fetching pair of goggles, protective goggles for sleeping in. Lovely. But they did actually come in very handy, because one of the nights Keith did actually elbow me in the eye. Thankfully I was wearing them. The nurse goes through all of the aftercare, lets you sit there as long as you need, and then you're sent home. And I think I was home by probably just gone 12. So it was, you know, 11 into the operating theatre. This includes a half-hour trip driving home as well, so it didn't take that long at all, actually. And then you're recommended to sleep for the rest, well, as much as you can for the rest of the day. So got home, had a quick bit of lunch, and then slept probably for about 3 or 4 hours. And then when I woke up, it was time for all the drops and everything, and my eyes were feeling really quite, you know, not great, but they weren't feeling that bad. Bit more gritty, gravelly. I'm trying to think of, actually, I can remember it like when I used to wear the hard contact lenses back in my teens. It was quite like that, just uncomfortable. I didn't like it, but not horrible. And basically that was the day. Going to bed, wearing the goggles, making sure you use the eye drops as and when you're supposed to, and just basically rest your eyes as much as possible for the first day, and then hope for the best for the next day for the 24-hour test. You go back for the 24-hour checkup, and they just check that it has all gone okay and it's starting to heal okay. But yes, happy with my experience. Very, very grateful to Optical Express for asking me to be part of Team 21. My vision is absolutely fantastic now. This is 12 days on, and I can see without glasses. It's brilliant. Yesterday was the first time I put makeup on, and well, it's not really makeup, I put a bit of eyeliner on just to see how it was. It was a bit strange, because as I drew the pencil across the eye, then when I opened the eyelid it was a bit cloudy again, and then took a second or two to clear up again, so I can only assume that's because there's still a bit of a cavity under the cornea. This is just me guessing, but obviously it's still healing, so you've still got to take care. But amazing.